South Korea saw 7,000 new COVID-19 cases over the weekend and reported the highest tally ever for a Sunday, in fact. Monday is expected to be another day close to 7,000. Also, starting this week, health authorities are pivoting towards what they are calling a new virus response, one that attempts to better cope with the spread of Omicron.
For more COVID-19 updates, we have our reporter Kim Yeon-seung here in the studio with us. Good morning, Yeon-seung.
Good morning.
So like we've touched upon, we actually expected the new infection cases to top 7,000 over the weekend, and it actually did.
Exactly. So South Korea topped 7,000 cases this Saturday for the first time in a month, with just 7,008 cases. And then on Sunday, cases soared even higher to 7,630, which is actually the second highest figure to be reported and the highest figure seen on a Sunday. If you look at the trend for the past week, you can see that just last Monday, the country reported fewer than 4,000 cases. So in less than a week, daily infections have nearly doubled.
And we hear as well that South Korea is expecting to see several thousand new cases again on this Monday.
Yes, exactly. So South Korea up to Sunday 9 p.m. logged 5,675 new cases. This is around 1,000 cases fewer than the same time Saturday night. But when the total tally is rounded up, it might just surpass that 7,000 mark.
So with the spread of the Omicron variant, authorities have changed some measures, but I heard that this week there are more changes that are happening.
Right, that's right, Won-geun. So COVID-19 has been with us for a while now, and one of the latest focus of health authorities are really trying to counter the inconvenience and the inefficiency that certain measures hold. For example, one of the changes they're making from today is extending the vaccine pass waivers to people who've been hospitalized or experienced adverse health effects up to 6 weeks after inoculation. These people don't need to prove causality between the vaccinations and their adverse symptoms. They just need to show that they had side effects at their local health clinics, and then they'll get a waiver on their mobile CUV or QR code apps.
And we hear some other changes as well are coming in from this week. Tell us more about that.
Well, starting from Wednesday, South Korea will start phasing into a new Omicron tailored virus response. The isolation period, for example, will be shortened for fully vaccinated patients to a week from 10 days. Also, beginning in regions that have seen alarming spreads of Omicron, namely Gwangju, Jeollanam-do Province, Pyeongtaek City, and Anseong City in Gyeonggi-do Province, health authorities are trialing a new virus response system. Under this new system, COVID-19 testing centers will test only high-risk groups and suspected infections with a PCR test. Everyone else will have to test themselves using a rapid antigen test kit. This will shorten the lines and speed up the process at testing centers. In these areas as well, local doctors and health clinics will also participate in testing and treating COVID-19 patients so that infected patients don't completely overwhelm the few selected COVID-19 clinics that we have on hand. Also, starting in Anseong City from Monday, local COVID-19 patients will be managed locally. What I mean by that is that COVID-19 patients used to be managed by the central government, and they decided where they will send these patients and treat these patients. But Anseong City officials are now in charge of making that decision on a local scale.
So how exactly will these measures help?
Right. So one of the main concerns with Omicron is that considering how fastly and rapidly it's spreading, the sheer number of infected patients might overwhelm the medical sector, even though it's been linked with milder cases. So this measure will spread any burden across local doctors and allocate the limited medical resources that we have on hand efficiently to benefit high-risk groups of people and to prevent them from reaching critical cases.
Okay, and we have the 5-day-long Lunar New Year coming up at the end of this week, starting this weekend. Do we have any special preparations in place for that?
Yes, we do. So I'm sure many people are looking forward to this Lunar New Year holiday because they get the much needed rest they need. But unfortunately, there's some people who aren't going to be able to rest, and these people will be frontline medical workers. Seoul City on Sunday said that they're going to keep the doors open at testing centers, infectious diseases hospitals, and residential treatment centers. There's also going to be a hotline in place for emergency patients. Seoul City is also expanding transportation during the holidays so that people can leave Seoul on less crowded buses.
All right. Let's hope there won't be, rapid spread over the holidays. Thank you so much for your report, Yeon-seung.
Thank you.